Question 1. A nurse is making shift assignments. Which task is most appropriate to assign to an experienced LPN? A. Developing a care plan for a new admission. B. Administering 4-push medication. C. Monitoring a stable post-op patient. D. Teaching post-discharge instructions. Answer. C. Monitoring a stable post-op patient. Question 2. Which client should the nurse assess first? A. A patient complaining of a mild headache. B. A patient with a history of hypertension reporting chest pressure. C. A patient waiting for discharge. D. A patient requesting a sleeping pill. Answer. B. A patient with a history of hypertension reporting chest pressure. Question 3. Which task is best delegated to a UAP? A. Administering oral pain medications. B. Repositioning a patient every 2 hours. C. Assessing a wound for signs of infection. D. Providing post-op teaching. Answer. B. Repositioning a patient every 2 hours. Question 4. What is the nurse's first action when a fire breaks out in a patient's room? A. Attempt to extinguish the fire. B. Notify the physician. C. Rescue the patient. D. Pull the fire alarm. Answer. C. Rescue the patient. Question 5. Which statement by a UAP requires immediate correction by the nurse? A. I reminded the patient to use the call light before getting up. B. I helped the patient to the bathroom with a gait belt. C. I lowered the bed after repositioning the patient. D. I turned off the oxygen because the patient said he didn't need it. Answer. D. I turned off the oxygen because the patient said he didn't need it. Question 6. The nurse delegates vital signs for a post-op client. What is the nurse's responsibility? A. Review and interpret the findings. B. Ask the LPN to verify results. C. Document findings without review. D. Delegate interpretation to the UAP. Answer. A. Review and interpret the findings. Question 7. Which task can an RN delegate to a UAP? A. Suctioning a tracheostomy. B. Educating a patient about anticoagulants. C. Feeding a stable patient with mild dementia. D. Administering subcutaneous insulin. Answer. C. Feeding a stable patient with mild dementia. Question 8. A nurse finds an unresponsive patient with no pulse. What is the priority action? A. Check the chart for DNR status. B. Call the family. C. Begin chest compressions. D. Notify the provider. Answer. A. Check the chart for DNR status. Question 9. A nurse sees a colleague preparing a medication without a label. What should the nurse do? A. Ignore it unless harm occurs. B. Report the nurse to the board. C. Stop the nurse and address the safety issue. D. Watch to see what happens. Answer. C. Stop the nurse and address the safety issue. Question 10. Which action by a nurse demonstrates safe delegation? A. Asking a UAP to assess lung sounds. B. Assigning an LPN to insert a central line. C. Having a UAP collect a stool sample. D. Telling a UAP to teach ostomy care. Answer. C. Having a UAP collect a stool sample. Question 11. A client is anxious and has oxygen saturation of 84%. What is the nurse's first action? A. Notify the respiratory therapist. B. Apply oxygen and raise the head of the bed. C. Call the provider. D. Administer a sedative. Answer. B. Apply oxygen and raise the head of the bed. Question 12. A client with a known fall risk is found standing without assistance. What should the nurse do first? A. Yell at the client to sit down. B. Gently assist the client back to bed. C. Document the behavior. D. Call the family to watch the client. Answer: B. Gently assist the client back to bed. Question 13. Which situation requires immediate nursing intervention? A. UAP places non-skid socks on a fall risk patient. B. A nurse gives discharge teaching without using teachback. C. A UAP checks blood sugar for a diabetic patient. D. A nurse assigns a new LPN to a stable client. Answer: B. A nurse gives discharge teaching without using teachback. Question 14. The nurse receives 4 reports. Which client should be seen first? A. A client with a stage 2 pressure injury needing a dressing change. B. A client with shortness of breath and increased respiratory rate. C. A client requesting pain medication. D. A client waiting for ambulation assistance. Answer: B. A client with shortness of breath and increased respiratory rate. Question 15. A float LPN is assigned to a pediatric unit. What is the nurse's responsibility? A. Allow full independence. B. Supervise tasks unfamiliar to the LPN. C. Have the LPN perform assessments. D. Assign 4 pushes to the LPN. Answer: B. Supervise tasks unfamiliar to the LPN. Question 16. Which patient care task must the RN perform personally? A. Administering routine oral medications. B. Repositioning a patient every 2 hours. C. Initial patient education on wound care. D. Collecting urine output measurements. Answer: C. Initial patient education on wound care. Question 17. What is the first action when a patient experiences new onset confusion? A. Reorient the patient. B. Assess vital signs and oxygen level. C. Notify the healthcare provider. D. Request a psychiatric consult. Answer: B. Assess vital signs and oxygen level. Question 18. Which task is inappropriate to delegate to a UAP? A. Assisting a client with bathing. B. Feeding a client with no swallowing difficulty. C. Administering enemas to multiple clients. D. Monitoring for response to diuretic therapy. Answer: D. Monitoring for response to diuretic therapy. Question 19. A nurse assigns a new graduate to care for a post-op client. What must be ensured? A. The new nurse knows facility policies. B. The client has no orders. C. The nurse is supervised closely. D. The nurse is left to function independently. Answer: C. The nurse is supervised closely. Question 20. A nurse receives lab results showing a critical potassium level. What is the priority action? A. Recheck the lab in 2 hours. B. Call the healthcare provider immediately. C. Document the result and notify the charge nurse. D. Ask the patient how they feel. Answer: B. Call the healthcare provider immediately. Question 21. Which of the following tasks is safe to delegate to an experienced UAP? A. Evaluating a patient's intake and output for the past 24 hours. B. Assisting a stable patient with oral hygiene. C. Teaching a patient how to use a walker. D. Changing a sterile wound dressing. Answer: B. Assisting a stable patient with oral hygiene. Question 22. The nurse receives a report on 4 clients. Which client should be assessed first? A. A client with mild abdominal discomfort. B. A client with blood glucose of 78 milligrams per deciliter. C. A client with new onset slurred speech. D. A client awaiting discharge instructions. Answer: C. A client with new onset slurred speech. Question 23. What is the most appropriate nursing action when a patient begins to vomit while supine? A. Leave the room to get suction equipment. B. Turn the patient to the side immediately. C. Offer the patient a basin. D. Instruct the UAP to stay with the patient. Answer: B. Turn the patient to the side immediately. Question 24. Which statement made by a UAP requires intervention? A. I walked the client using a gait belt. B. I emptied the Foley bag and recorded the output. C. I taught the client how to check his blood sugar. D. I helped the client to the bathroom. Answer: C. I taught the client how to check his blood sugar. Question 25. What is the nurse's priority action when hearing an 4-pump alarm in a confused patient's room? A. Silence the alarm and check it later. B. Call for the floor nurse. C. Immediately assess the patient and the foresight. D. Ask the UAP to reset the pump. Answer: C. Immediately assess the patient and the foresight. Question 26. Which of the following assignments is inappropriate for an LPN? A. Administering oral medications to a stable patient. B. Reinforcing teaching about a new diet. C. Developing a nursing care plan. D. Monitoring a patient with chronic wounds. Answer: C. Developing a nursing care plan. Question 27. A client complains of dizziness when standing. What is the nurse's priority action? A. Ask the client to ambulate to increase circulation. B. Place the client in a high Fowler's position. C. Assess the client's blood pressure lying and standing. D. Notify the provider immediately. Answer: C. Assess the client's blood pressure lying and standing. Question 28. The nurse sees a UAP transferring a patient without using a gait belt. What is the priority action? A. Report the UAP to the supervisor. B. Provide in-service training at shift end. C. Immediately stop and demonstrate proper technique. D. Document the incident without intervening. Answer: C. Immediately stop and demonstrate proper technique. Question 29. A nurse finds a patient unconscious on the floor. What is the first nursing action? A. Start CPR. B. Call the provider. C. Check for a pulse and breathing. D. Document the fall. Answer: C. Check for a pulse and breathing. Question 30. Which task is safe to delegate to the UAP in a long-term care setting? A. Assessing skin for pressure ulcers. B. Ambulating a stable resident after breakfast. C. Teaching fall prevention. D. Evaluating the effectiveness of pain medication. Answer: B. Ambulating a stable resident after breakfast. Question 31. What is the RN's responsibility after assigning tasks to the UAP? A. Trust the UAP's experience and move on. B. Hold the UAP accountable for nursing judgment. C. Provide supervision and follow-up. D. Document only what the UAP reports. Answer: C. Provide supervision and follow-up. Question 32. A nurse sees a client with Parkinson's attempting to walk unassisted. What is the best response? A. Allow the patient to try independently. B. Gently assist the patient and use a gait belt. C. Notify the provider. D. Call for physical therapy. Answer: B. Gently assist the patient and use a gait belt. Question 33. Which nursing action best demonstrates maintaining a safe care environment? A. Silencing alarms in patient rooms. B. Keeping call bells within patient reach. C. Encouraging clients to stay in bed. D. Turning off bed alarms at night. Answer: B. Keeping call bells within patient reach. Question 34. A client receiving for antibiotics develops a rash and shortness of breath. What is the nurse's priority action? A. Notify the provider. B. Stop the infusion immediately. C. Check for fever. D. Document the reaction. Answer: B. Stop the infusion immediately. Question 35. Which situation requires the most immediate intervention? A. A patient with a blood pressure of 138/88 mmHg. B. A confused patient found on the floor. C. A patient requesting assistance with toileting. D. A family member asking about visiting hours. Answer: B. A confused patient found on the floor. Question 36. A nurse observes a colleague administering the wrong medication. What is the appropriate response? A. Report the incident to the unit manager. B. Confront the colleague later. C. Say nothing unless harm occurs. D. Change the documentation to match the error. Answer: A. Report the incident to the unit manager. Question 37. A client with an order for ambulate with assistance is walking alone. What should the nurse do first? A. Document the noncompliance. B. Notify physical therapy. C. Assist the client and reinforce safety instructions. D. Call the provider for new orders. Answer: C. Assist the client and reinforce safety instructions. Question 38. A nurse delegates ambulation of a post-op patient to a UAP. What instruction is essential? A. Encourage the patient to walk as far as possible. B. Let me know if the client gets tired. C. Monitor the heart rate during ambulation. D. Stop if the client becomes dizzy or short of breath. Answer: D. Stop if the client becomes dizzy or short of breath. Question 39. The nurse notices a client's oxygen tubing is disconnected. What is the priority action? A. Call the respiratory therapist. B. Reconnect the tubing and assess the client. C. Notify the provider. D. Document the incident. Answer: B. Reconnect the tubing and assess the client. Question 40. Which action is unsafe delegation? A. UAP assists with bathing. B. LPN reinforces teaching. C. UAP administers medications. D. LPN monitors a stable wound. Answer: C. UAP administers medications. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.